Hi everyone, I am Dr. Arthur Bud Burnett, a urologist from the United States who specializes in sexual medicine. I'm here today on behalf of the Sexual Medicine Society of North America to teach you about sexual topics you have always wanted to learn, but didn't know how to ask. This video is not intended to offer medical advice or to endorse certain treatments or products. Stem cell therapy is an area of ongoing research and potential treatment for erectile dysfunction, ED. Stem cells are cells within our bodies that have the ability to regenerate new tissue. These treatments fall under the category of potential regenerative therapies, or types of treatments designed to regenerate or heal the normal erectile tissue of the penis to allow for natural erections and reduce or eliminate the need for medications. Stem cell therapy and other regenerative therapies are still very experimental in nature. With that said, what do we know so far? There are several basic science and animal studies that have demonstrated a positive effect of stem cell therapy on erectile function. These studies were also able to show the probable mechanism of action. The stem cells cause growth of new blood vessels, cause the release of growth factors that lead to tissue healing, and increase the elasticity of the tissues in the penis. While this is very promising data, we know that findings in the lab do not always translate directly to clinical outcomes in humans. There have been small-scale clinical trials involving humans that have had mixed results and short follow-up periods. Because of the lack of consistent efficacy with these treatments, no larger long-term studies have been performed. Additionally, many of the follow-up animal studies failed to show that injected stem cells remained in the penis over time. Because of this, there has been increasing doubt as to their true efficacy. In summary, at the present time, the safety and efficacy of stem cell treatments are still unproven. How is the treatment performed? There's not yet a commonly accepted treatment protocol. However, in general, the treatment consists of first taking the stem cells from the patient and then injecting them into the erectile bodies of the penis. Taking stem cells from a patient can be done in a few different ways. Two of the more common ways they can be harvested are from fat cells through liposuction or from bone marrow from a biopsy. Both methods require an invasive procedure that carries some risk. Sometimes stem cells from other sources can be used, such as from umbilical cord or placental tissues. This removes the risk of an additional procedure, but adds a new risk of transferring tissue from one person to another, which can cause harmful immune responses or risk transferring infectious diseases. No matter the source of the tissue, be it fat, bone marrow, or others, it then needs to be processed to isolate the stem cells from the other normal tissues. This is an expensive and highly specialized process. Following the isolation of the stem cells, they are generally then injected directly into the erectile tissue of the penis in a quick outpatient procedure that can usually be done with only local numbing of the area. There is not a commonly accepted treatment regimen for the frequency or total number of injections, although many protocols use a series of injections over time. This therapy is currently regulated by the FDA, and as such, no center offering stem cells is legally allowed to state that they are effective in the treatment of erectile dysfunction. Because of the potential safety risks, many centers offering stem cells have been closed by the FDA over the past several years. In summary, stem cell therapy for ED is one possible future area of treatment which has the potential to truly improve underlying erectile function. However, due to poor prior outcomes with human studies, there is relatively limited research ongoing into this treatment modality. Additionally, given its regulated nature, the legal administration of stem cells is most often limited to clinical research trials. Because of this, it is not currently recommended by any reputable scientific body pending further studies. That's it for today. Check out the rest of the videos on sexual health topics. SMSNA is here to help you to get better sexual education and improve your sex life.